The numbers that we had for New Brunswick as provided yesterday, 104 in hospital, 9 in ICU, and 3 on ventilators. Is that where we start this day today, or has there been any change in New Brunswick?
We do expect some updates later today, but that's the information we have as of yesterday.
So that's an upward trend. Ontario and Quebec are talking about early signals that the Omicron wave has reached its peak. It doesn't sound like that's the situation in New Brunswick.
No, we're a bit behind some of the other provinces in terms of when we'll reach our peak because our case numbers started to increase after theirs.
So it is an upward trend and one that has led the province to move, as I was just indicating, at midnight tonight to its highest level of restriction. I'm wondering, anyone not watching your briefing yesterday, if you could explain what is the situation, why you have to move to that near lockdown situation.
So our healthcare system, our healthcare workers have been strained, obviously, throughout the pandemic. And even, as you know, prior to the pandemic, I don't think any hospital systems were doing super. But this extra strain has really compromised our ability to continue to deliver really quality acute services at this moment in time.
And the Premier spoke to that reality, too, as he called it a crisis. His words were that New Brunswick is failing to serve the most critical needs right now. What are you not able to do right now as a result of COVID?
So the biggest changes right now in terms of our capacity, in terms of the increased numbers of hospitalizations for people with COVID, but also we're really challenged with our healthcare workers who are testing positive for COVID and then having to isolate. So we're getting hit in 2 ways. And what it's impacting is, I think we've postponed in certain hospitals over 500 surgeries, things like that. But again, we know that it can get worse, and that's why we wanted everybody in New Brunswick to take these steps now.
Well, indeed, the projection is if nothing were to change, it would be 220 hospitalizations by the end of this month. And I know doctors in your province are supportive of these measures because of that fact, and they use the word untenable to reach that level of 220 hospitalizations. We're at 104 now in New Brunswick. What would 220 look like?
Well, as you get closer to that number, that means that we wouldn't be able to offer those critical care services, and having to make a decision for somebody who had COVID or non-COVID acute care needs, whether it's a car accident or heart attack, making choices around life and death for those individuals would be what it would come to, and that's what we don't want to see happen.
And so, the level 3 restrictions. From the Premier yesterday, we're going to listen to some tape together, Dr. Russell. He himself just recovering from COVID. And certainly a note of frustration, I think, in some of his comments yesterday as he talked about 9% of the population accounting for 70% of hospitalizations, 9% of population, that's people who are unvaccinated or partially vaccinated, or it's been more than 6 months since their second shot. Let's listen to the Premier yesterday.
We are not going to go through 2022 with our province in lockdown. We're going to do what is necessary to protect all of New Brunswickers and to compel people to get vaccinated. Life will become increasingly uncomfortable and more difficult for those who are able to be vaccinated but choose not to be.
He seemed to be signaling then there that mandatory vaccinations could be coming. What is in the offing, Dr. Russell? When could that be being brought in?
Well, we're going to definitely explore opportunities in terms of trying to get people boosted and with their third dose, with their first dose, with their second dose. We're actually increasing our capacity right now from 40,000 doses a week to around 90,000 doses a week. So this 2-week period is critical to be able to get as many people vaccinated and boosted as possible. So again, we'll be looking at all opportunities to make that happen. We know in areas that it has been mandated in different sectors that it has
Just had a little bit of trouble with a signal. I hope I'm not losing you, because I want to continue on with that line of questioning. When you say in different sectors it has worked, I look just next to you to Quebec, for example, seeing an increase in people getting shots when they said that the unvaccinated would not be allowed into liquor and pot stores. And now, yesterday, we got the announcement from the Premier that that would also be extended to big box stores for retail shopping. But then Quebec put on the proposal as well of a tax on the unvaxxed, although the details, of course, still not clear on that. Would you look at those either punitive measures or, the kinds of restrictions to the things that I was mentioning, or would you go as far in New Brunswick as a tax similarly?
I can't speak for what the government policies would look like. All I can speak to right now is exploring any untapped areas that we could increase our vaccination rates. Again, in certain sectors, it's worked already. So we'll just see if there are any other places where we can look at that. But certainly our commitment during this 2 weeks, sacrifices that New Brunswickers are making right now to stay at home and stay as close to home as possible within their one household bubble. At the same time that's happening, we do want to increase, again, our vaccination and our booster rates.
And are there, I guess what I'm asking is, are there options that you favor to accomplish that, to boost the vaccination rate? What more can you do?
Well, again, those opportunities are being sought out right now. Those conversations are happening as we speak.
Okay, we'll continue to follow that, obviously, to see if New Brunswick can have the desired effect. You mentioned your healthcare workers. The number, as of yesterday, 386 healthcare workers off with illness, and that has created this staffing situation. You're looking for extraordinary measures there as well, inviting retired nurses, for example, to come back, healthcare workers to return, but also considering something we've talked about in Quebec and in Ottawa hospitals as well, and that is allowing healthcare workers who are positive for COVID, even symptomatic, to return to work. Now, that's an extraordinary circumstance. How do you see it happening in New Brunswick?
Well, obviously, within the hospital system and the long-term care facility system, we are looking at all the things that we absolutely need to do, understanding that these are not ideal situations or circumstances with respect to risk, but it's about balancing those risks, again, at this critical point in the pandemic and in the Omicron surge.
But how specifically would it work? I mean, is there not the potential? Nurses have told CBC that's sort of obviously not sort of counterintuitive, rather than protect the potential to actually infect. Or how are you going to safeguard if you're having healthcare workers who themselves are dealing with COVID interacting with patients?
So there are criteria around when this would happen, and there are criteria around what protective gear they have to wear and how they would be interacting with patients and staff. So that will be very strictly adhered to. And again, it's out of necessity. We certainly don't want to put people at risk unnecessarily. We are just really strapped right now in terms of what the situation is creating within the healthcare system, within the long-term care facility system. And you can see this is going to also impact critical infrastructure as well.
Given the severity of the situation, which you have really reinforced this morning, the level 3 restrictions just for 2 weeks, that seems a short time to accomplish what you need to do. Can you get it done in 2 weeks? Is that enough to do what you have to do in New Brunswick?
Well, New Brunswickers have done this before. They know how to do it, and they know how to do it well. We have faith in the population. They are resilient. We are counting on them. The healthcare system and the healthcare workers and critical infrastructure folks, we are counting on the goodwill of the population at this point in time, understanding that they're tired, understanding that they're frustrated. And this is, again, not an ideal situation, but out of necessity, because of the serious nature of it, we have no choice.
Dr. Russell, I appreciate your time today at a very busy time for you and everyone in the province, and we'll certainly be in touch and watch these next 2 weeks as they transpire in New Brunswick. Thank you.
Thank you, Heather.
Dr. Jennifer Russell is in Fredericton this morning.